As the years have progressed for nurses, they've gotten busier and busier with other tasks such as charting an electronic health record, answering calls, triaging between 8 different physicians or other stakeholders that are caring for that patient. They're kind of the air traffic controller. The average nurse walks 7 miles a day typically in a 12-hour shift. My job is to take great care of them so they can take great care of the patient. One of the first things the staff asked me about was, can we please get chairs to chart on? We do bedside charting. In critical care, your patient's very unstable, so a lot of changes. You have to remain with them almost constantly, and they had computers set up in the room, but they were standing and charting the whole time. So it seemed like a simple ask. I said, absolutely. So I did some research and found out that we had a foundation grant that would allow us to submit our idea to see if they would grant the money for it. And we wrote a pretty compelling story from the nurses to them about why this would be important to them. It would save our feet, we could spend more time with our patient, we can be eye level with our patient, it's more meaningful. And the foundation gave us the grant, and I thought my staff were gonna lose their mind. They were so excited. But being able to sit and be right next to your patient, especially when they're critically ill, is such a, I mean, that convey of empathy in that moment, I think, is really healing for the patient too. So I think it's helping the nurse and the patient both. This investment in the team meant a lot to them. I think it signaled to them that we're very invested in our staff and making sure that they have the tools they need to take great care of patients. That's part of our mission and our vision here. And having people in the community who are willing to give money to that purpose, it comes full circle. You know, we're taking care of the community and they're taking care of the nurses who are doing the work as well.